Dr. Young is a board-certified surgeon specializing in the nose and sinuses. His expertise includes facial plastic surgery, such that he can treat medical and cosmetic conditions related to the nose and face. He's a founder of the Miami Nose and Sinus Center, where primary focus is on minimally invasive nasal and sinus procedures for snoring and sleep disorders. Dr. Young, thank you so much for taking the time to be with us today.
Thank you so much for having me, Seth. It's a pleasure and an honor to be a part of this web seminar.
So Dr. Young, did you grow up in the South? Because you went to Tulane and then you went to Vanderbilt, or did you grow up in the South?
Actually, I did. I grew up in Texas and Mississippi, Houston, Texas for the earlier years. For the more formative years, I was in Jackson, Mississippi. And Tulane was a great choice for me because it was close to home, but not too close to home. And they had one of the best biomedical engineering programs at that time. And I knew I wanted to do engineering. I knew I wanted to do medicine. And it was a great opportunity for me.
So in high school, you knew deep down you wanted to get into the field, into the medical field?
Oh, it was much earlier than that. I was 5, 6 years old telling people, anyone that wanted to listen, that I wanted to be a surgeon. And I just always had that vision, that passion. And even though I didn't have direct family members or close family members that were in medicine, it was just something about the idea of being a surgeon that drew me in at a very, very early age.
So very cool. So from when you were a little kid, you always wanted to be a doctor?
As far back as I can recall.
And did your parents think you were crazy, or did they love it? What was your family thinking when you were saying that you wanted to be a doctor?
I had a very, very supportive family. They basically, whatever opportunity I saw or sought, they were fully supportive. And I had a little more, I guess, ambition than most, 5, 7-year-olds with some game plans in mind at an early age, but they were fully supportive. And I wouldn't be here now without that support and love from my family. And I owe it all to them. I mean, there was a modicum of hard work and dedication, but it's really having that support from an early age that really drives you.
Which I loved, hearing that when you were 5 years old, you had big dreams. So you went to Tulane, graduated from Tulane, and then was Vanderbilt your first pick, or was there other schools you were looking at? What made you choose Vanderbilt?
Yeah. So first with Tulane, wonderful opportunities, wonderful foundation. I was very blessed in that I actually had a full scholarship to the University of Mississippi for medical school. I guess most people do not have that opportunity, and many people, many physicians have tremendous debt afterwards, but I was blessed to get an academic scholarship where I didn't have to worry about the financial aspect as much. And then from there, I did apply to ear, nose, and throat surgery, which the formal name is otolaryngology head and neck surgery, which is a very competitive field. Most people don't realize that dermatology, ENT, and general plastic surgery are amongst the most competitive specialties. So I worked pretty hard when I was in medical school, and I scored for the board exams. There's different ways of scoring it, but I scored 99 out of 99, which afforded me opportunities to go and interview where I wanted. And my top choice for my specialty was Vanderbilt, for the reputation, for the resources. And Vanderbilt specifically was one of the top 5, and was and still is one of the top 5 programs in the country for my field. So it was both a blessing and an honor to go to Vanderbilt and train with literally some of the leaders in the country for my field, from head and neck cancer surgery to facial plastic surgery. We had the presidents of our national academic societies. We had some of the thought leaders. We had some of the authors of the very textbooks. So it was truly an honor to work amongst those. And I took it upon myself to work even harder and study even harder while I was there to really learn my craft as best I could. And I studied pretty hard with the training exams. And I scored really, really high, one of the highest scores in the country on that examination for all of the people in head and neck surgery, which that's not to boast. That's not to say that I'm a genius by any means, but I think it's a testament to hard work and dedication does pay off. So to any of those little 5-year-olds that are telling their mom that they want to be a surgery, you too can become a surgeon. You just have to stay dedicated, stay focused, and those opportunities will await you.
And so when you went there, I mean, did you ever want to quit? I mean, it must have been a lot of commitment and hard work with what your path to get to where you got to.
Never wanted to quit, but there are definitely times when, on paper, you're working 80 hours a week. In medicine, you're definitely working more than that, because even after you're done with seeing all of your patients as an intern and as a resident, you're still studying. I mean, it's not just a job as a surgical resident. You're not just doing these 10-hour surgeries. You're also reading about your patients. You're also reading about the latest techniques. You're also reading about how best to manage the patient. So it was definitely a lot of effort, a lot of work, a lot of sleepless nights, or at least minimal sleep. But I think that just makes you want it more when you realize how much effort it takes to get there, and you realize that there's so many people that would give almost anything to be in your position. So I took it as a challenge, but I also took it that I need to do everything that I can to be not just the best surgeon for my background, but the best surgeon, period, that I could be. And even with the academic accomplishments that I had, I'm actually more proud and more fond of the fact that I try to treat everybody like family. It doesn't matter how young, how old, how rich, how poor. I think that to become a truly good physician, you have to look at all of those elements of not just the academic part, but the social aspect of being a good provider. And I pride myself on trying to treat everybody that way, and literally asking myself, what would I do if it were my family member, my best friend, my neighbor? I would do everything I could to help them out. And never was there a time that I wanted to quit. I saw it more as there's always something else to learn, which is something that I bring to the office every day. I'm always trying to learn the latest technique, the latest data. And I think that you have to be a true student, no matter how much you've learned, no matter how accomplished you are. You have to look at it as there's always a little bit more to learn. You can always tweak it and get a little bit better.
So let's rewind. So after you finished Vanderbilt, what was next? Did you decide, like, where did you go from there?
Yeah. So it's about entering the real world.
Yes.
And after training, it's very different. You get all of this amazing training, but afterwards in the real world, many physicians don't, or rather in residency, you don't always get training on how to start a business, because in some regards, it kind of is a business, the business of medicine, which is somewhat taboo, because you have to focus on the academic part, which is very important. But a lot of places don't really teach you about contract negotiation or teach you about the insurance companies and how to deal with them. I was further blessed that at Vanderbilt, they actually did teach us a little bit about kind of the business of medicine, in the sense of contracts with hospitals or contracts with insurance companies. So I did have a little bit of a head start on it compared to others. When I looked at where I wanted to practice, the two main places that I wanted to look at were Texas and Florida. I wanted warm weather states. I wanted places with, I guess, low state income tax or no state income tax. I mean, it's something to look into, I have to say. But then I also wanted a good environment for my specialty. And those two states stood out the most, but I wanted to join a huge group. And the group that I joined was and is the second largest group in the country for my specialty. Pros and cons to that, but that's also the benefits outweigh the cons when it comes to joining a large group, because there's power in numbers, there's power in negotiating contracts with the insurance company, all those little things that they didn't really focus on in residency. You had a cushion with that with the larger group, where you have a CEO, a CFO, you have people that take care of that for you so that you can focus on being the best physician you can be. You can focus on treating the patient, not worrying about the insurance companies and Blue Cross or Cigna. And there's some people that really don't like the premise of a larger group, but for me, it seemed to be the right, pathway. And it's worked out well for me because I've truly been able to focus on my expertise and really fine tune my practice to exactly what I want and focus on the subspecialty within my field to provide the best care for my patients, because I don't have to worry and focus as much on, the insurance contracts and negotiations.
But even also getting office space, getting equipment, all those
Exactly.
things, all those things. But you're running a business within the group though, correct? So it's like your own
Yes,
business, but the group.
exactly.
Yeah.
Exactly. So it really is. So you have that cushion where we have our own HR department. We've got, as I mentioned, a CEO, a CFO. We have a vice president of marketing and procurement. So we have all of these things in place, but it's still my domain. And for instance, my office, we share and rotate offices, but at my specific main office in Aventura, I'm the only doctor here. I set up the office the way I wanted it, but I still had the backing of a large group in terms of the real estate negotiation. We literally had an expert in medical real estate that negotiated the contract for the lease for my office space in terms of the build out and the construction. So it was very much, it's very, very helpful to have that, because as a physician, you don't, or I would say in most businesses, even if you're a lawyer, you're not as savvy when it comes to real estate construction. So it's nice to have an expert specific to that to take care of that for you. So I can focus on what I do, which is the medical and cosmetic part.
And also probably because as I said, you're our fifth feature. And so a couple of the other doctors are like, hey, I just came out of law school and all of a sudden I get my office, I get this equipment, and I just got married and I'm telling my wife we can't get a house because we're all on our business and there's a lot of stress. So it probably makes your, like you said, you could concentrate. Now, are you still with the same group that you are from when you moved to Miami?
I am. Huge group. And it's made public domain now. We were acquired by a private equity firm. And there's a blessing in that, in the sense that I think that's the future of medicine, where they will be part of larger groups. And I think it's basically just been a positive. It's afforded us wonderful opportunities. And again, power in numbers. As you grow and expand, you get even better contracted rates. You can see what the group in the other state is doing. You can see what the group in the other city is doing. And we may not do everything exactly the same as state X, but we can learn from them. They can learn from us. And there's truly something to be said about that collaboration, because no matter how good you are as a lawyer, no matter how good you are as a real estate person, if you can learn from the realtors in New York, maybe you won't make the same mistakes as the realtors in New York. You can learn from the lawyer in Chicago. You won't make the same mistakes. So I think that there is something to be said about most industries combining their forces and learning from different regions and seeing if you can apply that to your own. And in our group, it has been helpful because we've really gathered a lot of knowledge from the other acquisitions to fine-tune things for ourselves. And it's still a work in progress. It's still something that we continue to evolve and improve ourselves. And it's not just settling for, okay, we've got a good thing going. It's how can you push yourself to be better, because a business that isn't growing is a business that's failing.
From when you went to school, Do you have any mentors that, taught you or meant a lot to you that, impacted your career?
Absolutely, absolutely. Most of my mentors were from Vanderbilt. I do have some mentors from medical school as well, but the ones that had the biggest impact on my career were probably Jim Medderville, who's a very famous head and neck surgeon, head, neck, and reconstructive surgeon that was once the president of the entire academy for our specialty.
Oh, wow.
Another mentor who unfortunately passed away last year was Russell Reese. He was a facial plastic surgeon that I learned so many techniques, not just in the operating room, but how to take care of patients and knowing when not to operate. A couple of my mentors had a saying, surgery is easy, judgment is hard. Meaning once you learn the nice techniques, once you learn the basics and the fundamentals, it's easy. Not to make our jobs look easy, but in terms of learning the physical aspects of surgery, it's relatively straightforward if you've got good mentors. It's the judgment, knowing who to operate on, who not to operate on, when to go a little bit further or when to just hold back. I think that's the judgment part that separates the good surgeons from the great surgeons. And I feel as if I was blessed to have that type of training. And those two specifically stood out to me the most in terms of affording me the opportunities to learn from not just the clinical aspect, but the surgical aspect and the personal aspect of how to treat patients.
So Dr. Young, because what you do is remarkable. Tell us some of like the surgeries that tell us like an average day, some of the surgeries that you go through during the day.
Yeah.
And the impact you have in people's lives.
Absolutely, absolutely, Steph. So the typical day, I spend a lot of the time in the office seeing consultations to see which patients are candidates for these surgical procedures. The technology for the nose and the face have evolved tremendously, tremendously. And I'll use the nose and sinus as an example because in terms of breathing, it affects so many different aspects of our life. Because if you're not breathing well, you're not sleeping well. If you're not sleeping well, it will affect every aspect of your life. Everything from your mood to your hormones to reflux, migraines, you name it. Inadequate sleep will affect all of those aspects. So a lot of what I do on a day-to-day basis is doing consultations to see who would benefit from just medical management or who would benefit from surgical intervention. The surgical intervention is twofold. You can divide it into in-office and in the operating room. Because the technology has evolved so much over the past 10 years, but really over the past four years or so, I can do most of the things in the office. For instance, if someone's having difficulty breathing through their nose, and let's say they already had a rhinoplasty. Hey, let's face it, it's South Florida. There are a lot of people that have had rhinoplasties here, whether it's in South Florida or whether it's in South America or other parts of the country. Many, many people have had surgery. And sometimes they're okay with the aesthetic aspect, but they still can't breathe. These technologies have evolved where I can do procedures that take anywhere from 5 to 20 minutes that can help with the collapse of the nasal passages so they can breathe better, or I can shrink the tissue on the inside of the nose with a device that's almost like liposuction. It's not removing fat, but it's a tiny device that suctions out the swollen tissue. Those devices take minimum amount of time. There's little to no bleeding. There's very little pain. And they come back, they're literally hugging you. Dr. J, I haven't been able to breathe like this in a decade. Or, wow, my gosh, I didn't realize how badly I was breathing all of these years until I tried the medicines first. And now it's like a whole other day. So I think whether it's from just an everyday function standpoint, if it's from a breathing standpoint, or if it's from an athletic standpoint, there's some people that are really into physical fitness. And I have a lot of neighbors and friends and colleagues that are doing many, many, high intensity workouts. They come to see me for a consultation, and they're like, "My gosh, my performance has improved." Now, I'm not saying you're going to go from running a 4.6 in the 40 to
I'm ready
a
to go.
4.2 in the 40.
I was telling April to set it up.
You know, and then we'll get you a contract with Antonio Brown or with some of these
Yeah.
other guys, right?
No,
No,
but
no, no.
I mean, I have a good,
but
I
it
mean,
will
I
help.
breathe well. So is that a big problem? Because I don't know. Is that a huge problem that people just can't breathe? Because I got to believe
That's a
that would
huge,
be a
huge,
nightmare
huge
to
problem.
not be able to breathe.
Huge problem. And there are many patients where they breathe, but my gosh, doc, every time I lie down, one side gets completely blocked and the other side gets
Oh, wow.
blocked. And I never fully feel all of my airflow going through. Very, very common. Some of this comes from structural problems, just the septum and the cartilage on the inside. Some of them is from allergies. Let's face it, we live in South Florida. There's always pollens and irritants, and some of these buildings, no matter how nice the buildings are, let's face it, they have mold, whether it's disclosed or not. And dust allergies are very, very prevalent as well. So all of those things lead to inflammation in the nose that can severely, severely impact the nasal breathing. Then what I find is that they oftentimes have subsequent problems with their throat, sore throat, because they're breathing through their mouth. It gets dry, it gets irritated, it gets inflamed. Or some patients are even having problems with their ears. They can't pop the ears. They get pressure on the ears when they go on a flight or they go scuba diving. They get horrendous pain and pressure when it really comes down to getting the nose under better control.
And how has the technology changed since you've left school to now? And where do you see technology going into the future?
Minimally invasive, Seth, minimally invasive. So a lot of these devices that took the full size of a room, or devices that were like 5-6 feet high, they've now been miniaturized into boxes about this big. And the technology itself has lent itself to minimally invasive techniques with radio frequency ablation. The devices I mentioned before, where it's almost like liposuction, it's called a submucous resection, to balloon catheter devices that are similar to the devices that are used for cardiac catheterizations. That technology has been employed for the nose and the sinuses, where you don't have to do the cutting that you had to before. You don't have to remove a ton of tissue. You can target directly the spots that are blocked and obstructed to help with all of the aforementioned symptoms.
And where do you see your business going over the next 5 to 10 years? Where would you like to see yourself go?
Sure. So I do a lot of minimally invasive. I do a lot of cosmetic. I see it continuing with both aspects. I don't see myself doing all medical. I don't see myself doing all cosmetic. But one avenue, in fact, I had a rep that came earlier today. I'm looking at getting a laser for my patients, because I've had so many patients ask for whether they have the need for skin rejuvenation, or laser hair removal, or if they're having problems with skin darkening, it's called hyperpigmentation, or melasma is another version of it, where they're asking more and more for opportunities or options for that. And surgery is very, very helpful, but it doesn't help with all of those. So the next phase for me will probably be a little bit more with lasers and or in-office procedures for skin and skincare.
And so if, do you ever like just pinch yourself knowing 5 years old, you had a dream living in the South, now you're in Miami with a successful business, doing what you love to always do. Do you ever pinch yourself with all the hard work with your success?
I guess dreams do come true to a certain extent. I think if you have the right mindset, the right attitude, and the right work ethic, you can see it to fruition. But I feel blessed. I think that's the best way to look at it. And I'm not done yet. I still have more, I guess, ideas for growth, more ideas for providing even more services for my patients. And I think not everyone has that mindset of continued growth. Many people become complacent, and that's fine. Nothing wrong with that. But I think people like yourself and myself, we're always looking for more opportunities in whatever our field is. And I think there's something to be said about that. And I think the most successful people, whether real estate or legal, they are always looking for opportunities to better themselves professionally, but also better themselves personally as well. And it doesn't have to be just a business success. I mean, if you can just look at growing yourself personally, I think that's an opportunity as well. So I don't ever see myself stopping in terms of learning. Even if I'm 80 years old and retired, I'll probably still be that guy trying
Would
to
you ever want
learn
to
something
teach?
else.
I always ask
Say that again?
doctors this, would you ever want to go to teach, similar to how a few doctors inputted impacted your lives? Is that something, you would ever want to do?
So the Latin root for the word doctor is teacher. I consider myself to be a teacher. I do teach. So I've had students rotate through from New Zealand, from Portugal, from Brazil. I've had local students. I had a student that is currently a first-year medical student at Emory Medical School now that rotated through. I wrote a letter of recommendation for her. She did a great job. I've had someone that came through before that finished medical school but was going transitioning to residency. And just an hour ago, I got a text message from a former student and patient, a little bit of both. I did a rhinoplasty on her years ago, and then she rotated through, and she's applying to medical school. So I do teach. Now, in terms of formally teaching at a university, I'm so busy with everything with the practice now that I don't envision shifting from this. But in terms of having students and residents come through, I welcome those opportunities. And now that we've gotten a little bit better with COVID restrictions, for now at least, that's a whole other different topic. But now we've gotten a little bit better with COVID restrictions. I can have more students come through. And I will probably try to do more and more formal, teaching endeavors in the future.
And so for somebody that's in your shoes back when you were at Tulane or at Vanderbilt, or what is advice or something that you would recommend to them that you think could mean a lot to them?
I would say first and foremost, they should seek a good mentor, and they should try to rotate with them. The reason why is because it is a long road, and that road is not for everyone. I love what I do. I'm passionate about what I do, but I realize it's not for everyone. So what I tell them is, when you're an undergraduate, when you're a med student, go ahead and rotate through. Try to find someone that's willing to teach you, because just that early exposure will allow you to say, you know what, I respect medicine, but just not for me. I don't like the hours. I don't like mucus. I don't like patients saying, oh, can you make it a little more narrow? You might think you love cosmetic, but you might get there and say, and I've had a couple of students say this, Dr. J, I love what you do, but man, your patients are always asking for something else. Like, are the patients ever satisfied? And I think that's a different topic too. We live in a day of selfies and filtered images, and everybody wants to be a little bit better. But I don't mind that. But for a couple of the students that have come through, that just wasn't their personality. They're like, wait, that patient is already beautiful. Why does she want more? If that's not your personality, you don't know until you get there and interact with them. Or even if it's something medical, maybe you don't like patients coming through with diabetes or chest pain. I would say for those students or those that think they're interested, rotate through. That's probably the best advice I can give you. Rotate earlier before you invest the time, effort, and energy, because not everyone is going to have that inkling when they're 5, 6 years old that this is what they want to do.
You're a very humble man. But let me ask you, what makes you good at what you do? What makes you special, in your opinion?
I would say two things. I'd like to say that I pride myself on keeping up to date with the latest technology. It doesn't matter how smart you are, it doesn't matter how well versed you are, things change. So if you're practicing medicine from 20 years ago, you could have been the genius of your class. Things have changed. Things have changed in 10 years. Things have changed in 5 years. So I think the most important thing is to be humble and realize that things do evolve. And if you're not adapting with the times, you're doing yourself a disservice and you're doing your patients a disservice. So I think that there are a lot of really smart doctors out there that unfortunately they're still practicing things from 20 years ago. And don't be wrong, there's nothing wrong with old school. I'm a little bit old school and to a certain extent. And you don't want to be the first one doing something, but you don't want to be the last one either, because then you're left to the wayside. So what I would say is that I feel that I do a reasonable job of staying up to date with the most current technology. And it doesn't mean that I adapt every new thing that's out. I like to see numbers. I like to see data. I mean, I have a degree in engineering. I like numbers. I like data. So if they can't bring me good data and numbers with the lasers or with the new technology, I'm a little more skeptical with starting off with it. So I'd like to say that's the main thing that I do that really separates me. That's one. And then with the modern technology. But the number two thing that's like kind of 1A, 1B is to treat everybody like family, as I alluded to before. Meaning, even if you have that technology, if it's a 90-year-old patient and you just don't feel like it's going to work for them, have the heart to say, look, this isn't for you. If it's someone that's a 23-year-old that already has the ideal aesthetic and they're trying to get a little bit more, just pump the brakes and tell them, look, I think you're beautiful as you are. You don't need that much more. And I think some surgeons, especially for cosmetic, they get caught up in maybe a little bit more. I'm going to do a little bit more, but you have to know when to say when. Surgery is easy. Judgment is hard. Would you do that procedure if it were your sister, if it were your family? If you ask yourself that, 99% of the time, your decisions are easy. So I think it's twofold to answer your question. It's to stay up to date with the most modern things, but to stay old fashioned in a sense and treat everybody like family that you like. We all have that one. But no, treat everybody like family. And number one, one aspect, and another aspect is to stay up to date and humble yourself to realize that you don't know everything and you can always learn a little bit more.
Well, Dr. Young, I really appreciate you taking the time with us today. I got to tell you, your story is inspirational to a lot of people because, you know, at the end of the day, you know, sometimes you don't pinch yourself, you know, because you're just grinding and working and working and working. But to see how, you know, you achieved your dreams at such a young age and where you're at right now should be inspiration to any 5-year-old that wants to be a doctor. It's one of the hardest. I mean, being where you're at is like being a basketball player. I mean, the chances of you going where you're at is very slim. So congratulations. But
I appreciate
I've
that.
known you for a long time, and I'm glad you got to share with how you got to where you got to. But I look forward, as you said, I don't think you're done whatsoever. I think you just started. So I look forward to seeing you become successful and growing. And I thank you for opening up to us today.
I appreciate the time. I appreciate the kind words. I appreciate you.
Thank you, Dr. Young. Enjoy the rest of your day.